trying to feel right here, okay? The PSISs are about 3 or 4 inches apart, okay? So if you're feeling, I don't feel anything, my number one suggestion is gonna be come out a little bit and circles. Anytime, thank you. Anytime you have a little projection coming out like this, if you just press in, everything kind of feels hard. But if you do little circles, you start to figure out, oh wait, I'm like actually going around something. I feel this. I feel a little something kind of in the center, and you can find it. Okay. Can I have another volunteer, please?
If you come in too pokey, chances are you might miss it too, right? It's harder for me to have a good surface area trying to feel if I'm only going in. I'm not giving myself a good chance.
Yeah. Okay. Okay. We're gonna come just like that. Okay. So iliac crests, it's kind of like windshield wipers. I kind of do this. 1 and 2. Okay. And again, I can feel those. And her right's more prominent than her left. Okay. On the skill check, you only have to find 1. Okay, I'm being nice. Okay, and 1 certainly might be more prominent than the other. Okay, people are weird. We have different little torsions in our pelvis, especially. Okay, so definitely feel both sides. And if you find 1, you're good. Okay, this is difficult. This is especially difficult if you have a patient who's heavier. Okay, and especially a woman, because women, we put all of our excess tissue right around our abdomen and our hips. Okay, do not be afraid of going, I can't feel this. Okay, I have tried, I can't find it. I've been a PT for 30 years. There are still patients, because what we do is we look for these to look for leg length differences and to look for pelvic rotations. If one of these PSISs was higher than the other, it could mean that there's a drop on one pelvis or a lift on the other pelvis or a rotation. So I need to be able to feel both, okay? And I'm looking to see if they're in alignment, okay? Often I will get a coworker and go, help, can you feel these? I can find 1, I can't find the other, or I can't find either, okay? If you can't do it standing up, also try the patient laying down, because sometimes tissue falls off to the side a little bit when we lay down. Gravity is wonderful. And that may clear these PSISs a little bit. Okay, try this one.